Lady is recognized.
Thank you, Mr. Speaker. Thank you, Ranking Member Pallone, for yielding, and thank you, Chairman Walden. It's a good bipartisan day for Michigan right now, and it shows you when we want to work together, we can and do and are going to make a difference. I rise in support of H.R. 5041, the Safe Disposal of Unused Medication Act, which I am proud to sponsor with my colleague from Michigan, Mr. Wahlberg, and I want to thank him for all of his good, hard work on this issue as we've learned together about things that are happening. Hospices performs an essential role in our healthcare system, and we need to make every effort to support hospice employees who do incredible work providing care and comfort in those final days of life. We need to make their jobs easier and as easy as possible. We also need to make sure that we are doing everything we can to stop opportunities for the diversion of opioids. This is essential if we are going to make a real impact in ending this epidemic, which is devastating to so many families in every corner of our country. This is an important bill which achieves both the goals of supporting hospices and stopping those opportunities for diversion. The Safe Disposal of Unused Medication Act closes a critical gap in our laws that prohibits the hospice employees from disposing of the unused opioids after a patient has unfortunately passed away. Right now, the way the law is, if a patient dies in hospice care, they have a large vial of unused opioids. The family cannot get any help from the hospice staff to dispose of them. For the family, they're in very difficult moments. They've just lost a loved one, and they don't need any additional problems like trying to figure out how to dispose of the unneeded opioids. This bill amends the Controlled Substances Act to permit hospice employees to handle controlled substances in a patient's residence in order to assist in drug disposal upon a patient's death. This common sense fix is a win for patients and their families, a win for hospice employees, and a win for public health efforts to crack down on this diversion. If we continue to improve our efforts to dispose of unused opioids like what we're doing in this legislation, then we will continue to ensure there are fewer opportunities for those pills to end up in the hands of those that abuse them. By passing this legislation, we can provide for the safe destruction of thousands, literally hundreds of thousands of unused opioids that might end up otherwise on the street and feed the addiction of too many. I'm pleased, as has been noted, that it has the support of both the National Association for Home Care and Hospice, the National Hospice and Palliative Care Organization. In closing, I again thank my friend and colleague, Mr. Wahlberg, for his bipartisan work on this bill and other opioid issues, and urge all members to vote in favor of H.R. 5041. I yield back.